I don't know about you, but I'm feeling kind of connected today. Nice to see you. My name is R.D. Sahl, and I teach broadcast journalism at Boston University. And this year at the Symposium, we're trying something a little different. Rather than keynote speeches in several cases, we're doing keynote conversations. And our first one in the series over this 2 days is with someone who is thinking about connected health not only now, but down the road and down the road a fair distance. I'd like you to meet Vinod Khosla, Khosla Ventures.
Very nice to meet you.
Co-founder of Sun Microsystems and a believer in connected health.
Yes.
Have a seat. Glad you're here.
It's great to be here.
A little over a year ago, you said you expected that technology will replace 80% of what a doctor does. Mm-hmm. What do you mean?
So, and this is often misinterpreted. I don't mean the role of the doctor will disappear, but the role will change very, very dramatically. That means diagnosis, prescription, monitoring, that won't be done by a doctor. The human interface, ethical choices, empathy, those will be the functions. I jokingly say we really should change admissions criteria to med schools so they look more like USC film school with lots of EQ and mirror neurons, not lots of IQ and absence of mirror neurons.
So in the world of connected health, you go to see your doctor. You'll still see your doctor, but how does that appointment change in the world of connected health?
So first, it's worth clarifying timeframes. I'm talking about 20 years from now, not today, and not 5 years from now. All of the tools of IT, information technology, are useful to improve medicine as it's practiced today. I call what we have today the practice of medicine. It's a lot better than medicine was 20 years ago or 50 years ago. So medicine has really improved care. We can't deny that. But it can be much better. And we have to acknowledge that the error rates in medicine are unacceptable. The error rates in medicine, if you look at the Institute of Medicine studies, are about the same as if Google's driverless car was allowed to drive if it only had one accident a week. No, that is the standard of care today. And I'm talking about not the best doctors. I'm talking about the median doctor or the below median doctor, the bottom 50% of doctors. And somebody is in the bottom 50%. Somebody actually argued with me on that one time. I had to change my slide to say source math. But those, the patients being served by those can be improved a lot. So let me give you a simple example. You're diagnosing a condition, you're talking to a patient, you ask a bunch of questions, very typical. Now imagine a rare condition that's very serious, which happens often. If you don't ask 2 questions to exclude that rare condition, and you may not have seen it because that happens 1 out of 1,000 or 10,000 times, you're not going to remember to ask as a doctor. So the first generation of systems might actually say, here's an additional questions to exclude this other thing. The version you've seen as a doctor, if your child has a cough, always ask the questions to eliminate strep throat. If it's not strep, it'll get better by itself. Those kinds of things happen all the time. So early systems will be what I call bionic assist. Suggest to the doctor, here's 2 additional questions that would exclude some rare condition, or a test that would exclude a cancer or irritable bowel disease or something more complex and chronic. So those kinds of assistive systems are starting to come in today. Take a disease like heart disease. Most people discover they have heart disease by having a heart attack. That's a pretty archaic. You shouldn't have to have a heart attack to discover you have heart disease. You should have, especially if you're at risk, BMI, genetics, a whole bunch of factors, have constant monitoring. So those are the kinds of things I think will be very relevant in the next 10 years. They'll enhance medicine as it's practiced today. They will allow physicians to do more. They'll let a nurse, skilled nurse, do what a physician, a primary care physician does. Maybe they'll let a primary care physician do what a cancer specialist or a cardiologist does. This general notion of upskilling people because they have bionic assist, so you don't have to discover you have heart disease by having a heart attack. You can avoid that catastrophe.
So you're talking about using data and monitoring to build a predictive element into medicine. Is there any role for artificial intelligence in this?
So I think the first generation of systems, the next decade, will be about assistance. If you are a heart patient, something happens at home, you have a little AliveCore device that tells you, hey, this is actually atrial fibrillation happening, not just heartburn. And you won't have to decide in a blind way whether you should rush to emergency or not. So those kinds of systems will happen. All of these systems, whether it's nighttime heart rate or other things over time, they will tell you, answer the question, do I need to rush to emergency, or is there something else wrong? They will then collect the data. And this is why I think machine learning and truly decision making is further away, is because you need lots and lots of data. Once you have lots of data, you can start to apply machine learning to it and start to actually do diagnostics. So AliveCore has an algorithm. Because they collect 1 million EKGs a quarter, they now have FDA approval to diagnose atrial fibrillation when you take an ECG with a $10, $20 device. They charge a little more for it today, but I keep trying to tell them to make it free. That's the kind of thing I'm talking about. So machine learning comes only after you have a lot of data. A lot of data you have only after you do a lot of monitoring and use of these digital devices.
And you need to learn to manage that data as well,
Yeah.
and have the capability.
And 5 years ago, most of the data was in paper and not usable. So there are practical problems of getting data usable that are pretty significant, but all that will change.
So from your seat, as you watch this process, what's driving this evolution in medicine? Is it healthcare reform, government policy? Is it physicians? Is it insurers, hospitals, patients? You can't leave them out of the equation.
Yeah. I actually think most of the really, first, all of those sources help. I actually believe policy enables the right things to happen, but policy doesn't make remote things to happen, new things to happen. I'll give you an example. Till last November, there was no way to get paid without a face-to-face consultation, so your physician always wanted you in their office. Since last November, Medicare changed reimbursement where you can actually get paid for remote monitoring and remote interaction with patients. That then enables that to happen. But it's really great entrepreneurs, and I know there's many here, who then say, I'll take this opportunity and make this service which is really valuable to patients. Much of it, I believe, will be driven by patients first. Once enough patients are using it. So imagine tens of thousands of patients using an AliveCore heart monitoring device and auto-diagnosing the ECGs, because it's been shown it's better than human cardiologists on average, diagnosing the same ECG. You then can prove cost reductions. At that point, insurance companies will say, hey, we should offer this to all of our cardiac patients. But the math justifies doing it if you could prove the cost. And I think the health systems will respond after the patients. And patients will do it because it's critical to them. Take a simple example like your child has a ear infection. I had 4 children. Every time that happened, first it was frustrating to try and get an appointment next day or in 2 or 3 days. And then me or my wife had to leave work to go pick up the kids from school, take them to the doctor. This complex thing could be done in 5 minutes at home when it happened. Much faster response, much better for the mother, the child. That's the kind of connected health stuff that I think becomes really, really critical. Whether it's ENT or dermatology or cardiology, all those can be done remotely quite well for 80% of the cases, not 100%.
Is connected health the key to bending the cost curve in healthcare?
Yes. I believe connected health or digital health or whatever you want to call it is key to that. But it's key to something else. I believe it's the only way to improve, both reduce the cost of care, but more importantly, to improve the cost of care. The less subjective decision making we have in the loop, the better healthcare quality we'll get. So the more these systems are used, healthcare quality will go up. That's sort of the sad part. It will reduce revenue for a lot of healthcare systems, hospitals and others, because when you say reduce healthcare costs, most people don't want it, except the people in the healthcare industry where cost reduction means revenue reduction for somebody on the other side of that equation. And the only way to improve quality dramatically is to reduce the care through technology, the cost of care through technology. It's a conundrum that I think will slow down the adoption of these technologies because the people who make money from providing healthcare will get hurt because of this.
Well, that turns a corner for us. You've given us the big picture of connected health and the evolution of it. What about the business of connected health?
So it will start in small ways. Telehealth is an example. To me, that's really pretty simplistic technology serving a very useful purpose. But there's no technology in telemedicine, or very little, from my point of view. Because there's no new data, the same doctors making the same subjective judgment instead of you sitting in their office, they're doing it remotely.
You're moving ones and zeros from one place to another.
Yeah. You're really moving your face from sitting across the chair to, if you were doing this interview, across a Skype connection. That's what we are doing. But adding more data to medicine that then provides more insights, because data is not useful till it leads to actionable insights. That's where connected health will really start to make a difference and really start to reduce the cost of care and prevent bad things from happening and improve the consistency of care. Care consistency is pretty bad today. For those of you interested, I have an 80-page thesis. If you Google 20% doctor included, it's on our website. It's a long PDF that I wrote about not only how medicine will change long term, but what are the stages of change. And the first few stages are pretty mundane. So we have pretty good healthcare today, but it looks like your floor-mounted cell phone. My first cell phone was a sewing machine mounted on the passenger side of my car. That's what healthcare is like, which is much better than not having a cell phone, right? We should acknowledge that. And just having landlines, which is much better than not having any phone at all. So when I was growing up, I never had a phone at home, and getting a landline was a big deal. And then when I got my sewing machine, it was really great. But it's nothing like the 7th generation phone, which is my iPhone today, right? So we have to acknowledge it'll happen in stages, in 3-4 year increments of innovation. And so we can't say what happens in 20 years. And it's very unpredictable how all this will show up, because innovation by its very nature is unpredictable. So I call this speculation, not prediction.
So in your VC venture, your venture capital business, what factors into your decision to invest in a company, a product, or a service?
So we look at two things. First, how extensive is the vision long term? How radical a change, how differentiated a value does somebody want to create? But we also look at what are the small incremental steps. What are the tactics? The tactics matter as much as the strategy. So we look in 2 and 3 years increments. Can they provide something useful that somebody will use that's a good Trojan horse to collect data that then leads to machine learning, that then leads to much better diagnostics, a much better prescription or decision making or decision support, all those kinds of things. But probably the overriding thing is how passionate and how good is the entrepreneur wanting to make this change happen. I generally find people who are doing it to make more money aren't that good because they aren't passionate about their mission. People who are passionate about changing healthcare, those are the people I really enjoy meeting with, talking to, and being driven by their sort of passion to change the world, so to speak.
So you're
They tend to make more successful entrepreneurs in the end because they're not misled by short-term tactical financial considerations.
But there are some short-term financial considerations. You got to keep the company afloat.
Yes.
To get to that goal that you're talking about at the end of the rainbow.
That's why I love entrepreneurs who are obstinate about their vision but flexible about their tactics. So tactics and survival, absolutely essential, but there's many ways to do that. If you don't have that vision, you're not going to change healthcare. And if you don't change healthcare in a significant way, the practice of medicine, you're not going to build a large company. You're going to build a tactical company. So there are tactical entrepreneurs and there are mission-driven entrepreneurs. I almost always prefer the mission-driven ones because they create the larger, more disruptive companies. Let me say one other thing. Today what we have is the practice of medicine. It's based on experience and cumulative experience and some research studies and all that. But we are far from the science of medicine. And my hope is in 10 or 20 years, we go from the practice of medicines, which doctors practice today, to the science of medicine. And so I'm passionate about converting the practice of medicine to the science of medicine. And that's really exciting. So you might do in cardiology, read an ECG the same way that a doctor would today, and in telemedicine present that remotely to a doctor to look at or auto-diagnose it. But if you can find new kinds of data that says you're about to have a heart attack in 6 hours, predict it. You've invented new science, and that's much more exciting. Often the tactical stuff leads to new science. That then makes for really interesting startups.
Step back to the business element of this. Can you tell us where your venture capital dollars are going? What kinds of companies? Maybe name several.
So these are the kinds of companies. For example, AliveCore has a simple hardware device. You can take an ECG with your cell phone anywhere. Right? And our average patient's taking 20 ECGs a month. That's the average patient. No doctor's heard of a patient having that many ECGs. Now, that wouldn't work. It would create liability for the doctor if you sent them all the ECGs. But if you send an automated diagnosis, which we have FDA approval to do, they can then say, oh, you had an AFib episode. Let me call you and take a look at this. That's serious because only 1 out of whatever 50 ECGs are worth really paying attention to. So that's exciting. Ginger.io, by tracking your cell phone's activities with your permission, can characterize mental health very, very accurately, frankly, more accurately than any psychiatrist can. They can be predictive if you're going to have a bipolar episode or if you're going to have a manic depressive episode. In one trial they did, in the first week of the trial, they found 3 highly suicidal patients they would never have discovered before. Think about it. All driven by data science, all by simple things on your cell phone, like how fast do you respond to your text messages, how often do you check your email. People have regular patterns, and when they go into a mental health episode, these patterns shift and they detect those patterns.
So as we come full circle at this session this morning, What are the metrics for measuring success? How do you know when you've made it?
Well, there's different kinds of success. Financial success is pretty easy to measure. What I like to measure is how did somebody change the practice of medicine? So we have a company called Lumiata, does gaps in diagnosis. So given any patient record, they can predict what diagnosis may have been missed. That is bad for the health insurer, it's bad for the patient, it's bad for the doctor. So they find gaps in diagnosis through machine learning technology, looking at existing EMR data, existing tests, all that. So that's an example. At the other end, we have a company called Guardant that does cell-free tumor DNA, so you can monitor cancer even monthly, looking for cells the body has destroyed in fighting your cancer long before it shows up where you can do a biopsy, for example, or post-biopsy follow-up to see if you can track the cancer before it's metastasized enough to. So the wide range of technology-driven stuff, all the intersection of computational sciences and biology. Really, really exciting stuff. We're doing non-invasive blood glucose monitoring, really exciting area, very, very difficult science. There's about 100 startups that have failed at doing that, but it's still worth doing. So I could go on and talk about blood pressure, glucose, heart rate variability, all these things will add dramatically to the data that then leads to new science over the next decade.
Thank you very much. A look at connected health now and what Vinod Khosla sees coming down the road, who knows how many years, but a goal we can all wish for. Vinod, thank you so much for being here today.
Thank you. So let me leave with one thought.
Oh, and your website too, because this thesis that he's written is really a great read.
So this thesis, if you can Google 20% doctor included, and it'll show up, but it's on our website at khoslaventures.com. But think of medicine today as that floor-mounted cell phone, and every 3 years, you'll see some significant change. It'll a lot more diffuse than cell phone generations. But it took 7 generations to get from that cell phone to the iPhone in your pocket today. That's how you should see medicine over the next 20 years, not see magic overnight. Thank you.
Exciting stuff. Please stick with us for a few minutes. There's some special awards coming up and presentations. Vinod,
thank you,
this has been great. Thanks so much.
Great.